Welcome back to Ronnie, I'm Joe B. Today I'll show you how to correct a lateral rib compression injury through muscle energy, non-thrust techniques, and exercises. Let's dive in. A lateral rib compression injury is when the rib is deviated inward or medially as compared to the rest of the ribs. The cause of this can be due to trauma by a lateral to medial blow. An anterior-posterior rib compression can bring about a localized dull aching pain on one side of the chest or axilla, increased by deep breathing. There's also an inward indentation of that dysfunctional rib as compared to the rest of the ribs. The assessment for a lateral rib compression requires the physical therapist to do a lateral rib sweep. The patient is in a side-lying position with the tested rib uppermost and the right hand at the head. The therapist will be in front of the patient with the left dorsal web space at the 10th rib, which is the lowermost palpable rib on the side of the trunk. The web space are slowly slid from the lateral side of the 10th rib upwards towards the axilla. Normal findings are that the ribs do not have an upward protrusion or sharp depression during palpation. Abnormal findings is that the right fifth rib in this case has a sharp depression. For the treatment, a muscle energy technique and a non-thrust technique can be done to laterally protrude the compressed rib. Let's assume that the fifth left rib is the one laterally compressed. The patient will be in a short sitting position at the end of the table with the left arm draped over the therapist's right shoulder. The therapist is standing next to the rib to be treated. In this case, the fifth rib. The thenar eminence of both hands are placed on the prominent anterior and posterior shafts of the fifth rib. The therapist uses both thenar eminences of the hands to apply a compression force on the fifth rib that results to lateral rib protrusion. Then side bends the trunk to the right to allow more lateral rib protrusion. Side bending to the left can also be added to allow autogenic inhibition for more side bending gains to the right and hence pop the left rib outwards. An autogenic inhibition is when the muscle is activated, in which case there will always be a relaxation of the muscle afterwards, allowing more range of motion. For the exercises, using a tennis ball pressed at the left posterior shaft of the fifth rib and another one pressed at the front shaft of the fifth rib can be held for 3 reps, 30 seconds each. So do you want to know how to correct a lateral rib protrusion or an anterior-posterior rib compression injury? If so, then watch this next video. Thank you so much.